What's going on, guys? It's Humphrey, and today we'll be talking about colon cancer. Colon cancer is the growth of cells that begin in a part of the large intestine called the colon. The colon is the first and longest part of the large intestines. The large intestine is the last part of the digestive system. The digestive system breaks down food for the body to use. Colon cancer typically affects older adults. Though it can happen at any age, it usually begins as small clumps of cells called polyps. Hopefully I'm saying that right. That form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancer over time. Polyps often don't cause symptoms for this reason. Doctors recommend regular screening tests to look for polyps in the colon. Finding and removing them helps prevent colon cancer. If colon cancer develops, many treatments can help control it. Treatments include surgery, radiation therapy, medicine such as chemotherapy, targeted therapy, and immunotherapy. Colon cancer is sometimes called colorectal cancer. This term combines colon cancer and rectal cancer, which begins in the rectum. I will do a separate video for rectal cancer in the near future. Symptoms: many people don't have colon cancer symptoms at first. But when symptoms do appear, they usually depend on the size of the cancer and where it is in the large intestines. Here's some of the symptoms: a change in bowel habits, such as more frequent diarrhea or constipation, rectal bleeding or blood in the stools, ongoing discomfort in the belly area, such as cramps, gas, or pain, or feeling that the bowels don't empty all the way during a bowel movement, weakness or tiredness, losing weight without trying. Causes: doctors aren't really sure what causes most colon cancer, or what are some of the risk factors. Some risk factors that may increase the risk of colon cancer: older age. Colon cancer can happen at any age, but most people with colon cancer are older than 50. The number of people younger than 50 who have colon cancer has been growing. Doctors don't know why. African Americans in the United States have a greater risk of colon cancer than do people of other races. A personal history of colorectal cancer or polyps, inflammatory bowel disease, inherited syndromes that increase colon cancer risks, family history of colon cancer, low fiber, high fat diet, not exercising regularly, diabetes, obesity, smoking, drinking alcohol, and lastly, radiation therapy for cancer. What are some preventions? Screening for colon cancer. Doctors recommend that people with an average risk of colon cancer consider starting colon cancer screenings around age 45. But people with an increased risk should think about starting screenings earlier. People with an increased risk include those with a family history of colon cancer. There are several different tests that are used for colon cancer screenings. Talk about your options with your healthcare team. Guys, have a talk with either your mom, dad, grandma, grandpa, whoever knows your family history, and you don't have to do this. I'm just saying, just so you guys can be safer. Actually know what cancers are in your family, because everyone's family is different. For mine is leukemia and breast cancer. That's in my family, I believe. But everyone's different, so just be safe, dogs. That's all you gotta do. Lifestyle changes to reduce the risk of colon cancer: eat a variety of fruits and vegetables and whole grains. Drink alcohol in moderation, if at all. Stop smoking. Exercise most days of the week. And maintain a healthy weight. Colon cancer prevention for people with high risk. Some medicine can reduce the risk of colon polyps or colon cancer. For instance, some evidence links a reduced risk of polyps and colon cancer to regular use of aspirin or aspirin-like medicines, but it's not clear what dose and what length of time would be needed to reduce the risk of colon cancer. Taking aspirin daily has some risks, including ulcers and bleeding in the digestive system. These options are generally reserved for people with a high risk of colon cancer. There isn't enough evidence to recommend these medicines to people who have an average risk of colon cancer. If you have an increased risk of colon cancer, discuss your risk factors with your healthcare team to see if prevention medicines are safe for you. Alright guys, hope you guys enjoyed. If you did, make sure you give it a thumbs up. I hope these videos help you in some way, shape, or form. If they do, make sure you give them a like, share, and subscribe and turn your post notifications on. If you guys want to see anything in particular, just let me know down below. I love you guys. I will see you in the next video.